Hi, my name is Dr. Anna Martinez, and this is my nurse Cindy, and we're here today to talk about some more questions. Today it's really on colposcopies. We get a lot of questions from patients when they're preparing for this procedure. Cindy, my nurse, tends to field a lot of those questions, so we were going to talk about this and kind of see how the procedure goes.
Perfect.
Can you kind of describe the procedure and what exactly is a colposcopy?
Colposcopy is basically just a big word for looking at the cervix with a microscope. A colposcope is actually just a microscope on wheels so that you can see the cervix.
And it does provide a little bit of a better picture whenever you get the pap smear result. If it is abnormal, it kind of gives us a little better idea of exactly what's going on under that initial cell layer.
Right. The main reason we do it is because you've had a pap smear that's come back for some reason as abnormal.
Absolutely. So a lot of patients ask, are they able to schedule the colposcopy during their period?
We really don't like to do it that way because if they're bleeding, you're not able to get a good view of their cervix. I mean, you are looking for cells with a microscope, so we would like to reschedule if you do happen to start your period.
Absolutely. A lot of people obviously always ask, is it going to hurt, or how painful is the procedure?
I usually tell patients that it's not excruciating, it's not the worst thing that they've ever done. They will probably feel a sometimes pinching type sensation and menstrual type cramping, but that the procedure itself, the part that causes discomfort, is actually very, very quick, and once we're done, that cramping and that discomfort just goes away.
The majority of the procedure definitely is looking, and so you feel the exam is a little bit longer than a traditional pelvic exam, but the actual pain, you're right, is a shorter time. What can they take for pain before the procedure?
I usually recommend that patients have a little something on their stomach for breakfast or lunch, and then take anywhere from 600 to 800 milligrams of ibuprofen, or Aleve is acceptable as well, and that usually helps take care of any discomfort they may have.
And as far as after the procedure, we often have patients ask how much are they going to bleed afterwards and what to expect as far as signs of too much bleeding.
We use a couple different medications after biopsies to stop the bleeding. Now, they may have a little bit of spotting or a funny discharge from the medication that we use to stop the bleeding, but they really shouldn't experience too much at all. Now, we tell them if they are having, afterwards, if they're having a heavy flow that's heavier than their normal menstrual day, then we usually ask them to call us, and that they might need to come back in for a little extra treatment.
And as far as, oftentimes we also have people ask us, how are they able to return to work? You know, do they need someone to drive them?
Absolutely.
That kind of stuff.
Once we're done, like I said, the discomfort generally just goes away, and you're certainly able to drive, you're able to go back to work. Your routine daily activities are not a problem.
As far as results, that's after having a procedure like this, I know people tend to be a little nervous. How long can they expect to wait for their results?
Generally it takes about 5 to 7 business days, so that's what I tell people. And obviously if patients are anxious, they can certainly call, and if I have something that I can get them, or if I can get the results more quickly, I will certainly try.
And also a big question, as far as having intercourse or anything in the vagina, like tampons, use, that kind of stuff, how long do they have to wait after the procedure?
We usually recommend waiting about a week, and that is so we don't introduce any kind of infection, or that they don't disrupt the biopsy sites and then cause bleeding. So that's the main reason for that.
Absolutely. These are pretty small areas that we're biopsying, but they do need a few days to heal. As far as other common questions we get, I think a big one is why are we doing the colposcopy? What is exactly going on?
Exactly. Well, most of the time, the reason we're doing it is because your pap smear has come back abnormal. Most often, it's because of the HPV virus.
That's true.
But if you get your routine yearly pap smears like you're supposed to, usually any kind of cervical abnormality is caught very, very early and completely treatable.
Absolutely. And we also like to encourage patients there's usually a regimen of follow-up after the biopsies, and so we really like to have patients to really want to follow up afterwards and keep their scheduled serial paps after the procedure.
That's probably the most important thing I stress with every